I will call this meeting to order. Health on November 20th at 10 a.m. Melissa, would you do roll call for us, please?
Thank you, Madam Chair. Sue Carlton,
Present.
Shirley Keaveney,
Keaveney.
Shirley Keaveney, Andrea Mestros, oh, I apologize. Matt Mastros.
That's it, see? There you go. Just relax.
Kevin Eccles,
Counterpoint.
Chris Peabody,
Present.
Kenneth Craig,
Present.
Helen Claire Timberlake,
Good morning, everyone.
Nick Saunders, Chad Richards, and Beverly Wilkins.
Thank you. Welcome, everyone. Welcome, Andrea. Glad to have you with us. And I'd like to do a recognition and read out a letter that Sue Patterson sent to Dr. Earl and myself. And in it, Sue says, after much reflection, I decided to not reapply to be a member of the board. It has been an honor and immensely rewarding to serve alongside such dedicated professionals over the years. This decision comes from a desire to open the door for fresh insights that can continue to drive the board's mission forward. I believe that bringing in new perspectives will only enhance the incredible work that we have accomplished together. Thank you for the camaraderie, support, and shared dedication throughout my tenure. It has been a memorable journey, and I look forward to seeing how the board will continue to grow and evolve while supporting population health and disease prevention in Grey First County. Kind regards, Sue. And Dr. Earl, you had a response back to Sue.
Thank you so much, Madam Chair. I have a response to Mayor Patterson, but even if I read it like that, I would do it justice. It's a privilege and honor to have worked with her to follow her leadership, dedication during the pandemic before and after has been instrumental, and her absence around the table will be felt. The lessons that we learned from her will continue. And again, it's been a privilege and honor to work with her. We thank her for this. And I wonder, Madam Chair, if it's I mentioned this before, if we have a ceremony or an event, maybe in 2025, to recognize the previous chairs, previous board members, Mayor Brian Milton, Barfoot, Mitch Truland, many people served around this board, and during the pandemic, there was no opportunity to have that ceremony, that closure, that thank you. And with your permission, the board would like to have this event 2025, we can definitely arrange and invite them.
Okay, I think it's a great idea. What does everyone else think? Seeing none, Ken.
Move to refer to staff the recommendation regarding the celebration of past members
Excellent.
and some more we brought to the.
Okay, that sounds good. Could I have a seconder for that, please? Kevin? And all in favor? That is carried. Thank you.
And Madam Chair, just to be complete, there are other members, Mr. Barfoot, Mr. O'Leary, Mr. Sullivan, Higgs. So it will include everybody who served over the past 4 years with the board's permission.
Okay, and now we move on to election. So Dr. will take over at this point.
So I'm assuming the chair role to complete the election, roll call was done. I will now open the floor for nomination to the board chair. Helen Claire, your hand is up.
Thank you, Mr. Chair. Through you, I nominate my honourable colleague, Mr. Nick Saunders, as chair. Mr. Saunders has spent a number of years around this table. For the first little while, he was given a place around the table, but not given a vote. Once being allowed a vote, he has contributed fully to the governance of this health board. Last year, he joined the executive. I recognise that our policy sets out that the position of chair shall alternate between Grey and Bruce counties. However, that policy is dated. It came from a time when only Bruce and Grey County was officially recognized, and certainly before people were aware of the need for inclusivity, in particular with regard to First Nations. I respectfully request that the policy be revised to acknowledge the need to also officially represent the First Nations in the executive. It's not enough to give those whose voices are traditionally
Madam Chair,
silenced.
point of order.
So I'm not actually chairing, Dr. Barrett. Helen Claire, we just have a point of order called, and I think I know what it is. We don't actually have a policy that says it goes from Grey to Bruce County. It's just simply been a courtesy, so it's not written in any of our policies. So we won't need to do any change there.
That's
Thank
not
you.
so-
Thank you, Madam Chair, and to the actual person chairing this. I would appreciate the opportunity.
Point of
It's
order.
ironic for
Sorry,
me.
point of order, Helen, there, you go.
It's just a nomination, it's a mover and a seconder. There is no opportunity for debate until you get process. Excuse me, I'm not,
It's definitely in front of me, but I believe, Helen Claire, when I finish something, and then we will move to, like, it's not on the floor.
No.
Yeah. So is there anyone to second the motion?
Mr. Chair, I'm sorry. May I finish my sentence?
I kind of said, yes, you can finish it, and I waited, you didn't say anything. Please go ahead.
Thank you. I do find it ironic that the sentence was that it's not enough to give those whose voices are traditionally silenced a place at the table. To avoid mere tokenism, those people who are traditionally silenced must also be given a voice and a platform. Because Mr. Saunders is qualified, he has a demonstrated commitment to our communities, and because it is fair and equitable to do so, I nominate Mr. Saunders as chair for the next term. Thank you, Mr. Chair, and thank you for allowing me, a woman of color, to be allowed to finish my sentence. Thank you.
Thank you, Helen Claire, for the nomination. Is there anyone else to second that motion?
I'll second that.
Ken, seconded. Moved by Ms. Tingley, seconded by Mr. Craig. And that Mr. Saunders be nominated as the chair for the board for 2025. Are there any other nominations for chair?
I'll nominate Ken Ray for chair.
Is there a seconder for the motion? So, Mr. Charles, Mr. Charles moved, Ms. Carlton seconded that Mr. Craig is nominated for chair for the board 2025. Are there any other nominations for chair? Are there any other nominations for chair? And the third time, are there any other nominations for chair? Since not, we do have an election and we have a component online, we have a component in the room to be completed. I'll turn it to,
So in front of you, if you're in the room, will be one that says your vote for chair. So please complete that and then I will come around and collect them. For those online, you know, we're now.
First ask if they will accept the nomination. Yeah, before we go to that point, we should actually make sure.
You're gonna stand? Do you accept the nomination? Yes. Okay, accepted the nomination. Mr. Craig, do you accept the nomination?
I would defer in that case.
Okay, and in this case, Mr. Saunders accepted the nomination, Mr. Craig preferred, Mr. Saunders accepted the nomination and acclaimed as the board chair for 2025. Congratulations. Congratulations.
And actually, we should just keep moving this way. Maybe. You not, no.
No.
This is now your stage.
Need a speech?
Need a speech? Need a speech?
No, how many? Chairs are.
I didn't bring that in here.
We can send those that down for you. Passes.
Let me grab
Sure.
my tea.
I kind of really like to you. Really hope you keep
Break your back lifting that thing. Actually, this is later.
Didn't get home here.
Don't we have to do the vice chair and that part? Okay, so I will now open the floor for nominations for vice chair for 2025.
Through the chair, I would like to nominate, Mr. Kenneth Craig.
Seconded. Is there any other folks? Ellen Claire?
Thank you, Mr. Chair. I nominate my colleague, Mr. Richards.
Do you accept? Folks?
I'll second that nomination.
Okay.
Yeah, just to get them official.
Okay, let's do it. Jumping in with both feet here.
Yep.
Okay, among friends.
Is there any other nominations? Mr. Craig, do you accept your nomination?
Once again, thank you, Chair. I will defer on that.
Mr. Richards, do you accept?
In that case, I will accept the nomination.
Then I guess that's, yeah. So Mr. Richards has accepted the nomination and has been acclaimed by the board chair for 2025, even though it's.
Congratulations.
That's it? Oh, the appointment for executive committee. How does that feel? Someone through a nomination.
People can nominate each other.
Okay.
Does it
There
have to be
any-
nominations or can it be volunteer?
Or can it be volunteer? Anybody volunteer for the executive committee? I see Helen Claire's hand up.
Mr. Chair, I'm sorry, I'm not volunteering. I sit on a tribunal. I don't have the time, but I believe that the executive committee is set out in a policy. I'm pretty sure it requires an addition of a provincial nominee, of which there might only be one, but perhaps the medical officer of health can guide us in this process. Thank you, Mr. Chair.
Thank you.
Yeah, thank you, Mr. Chair, through you. And the policy would require to have the chair, the vice chair, and two members, historically provincial nominees, but since the chair and the vice chair are provincial nominees, I see that the board might have the latitude to have a decision to, bypass that part, like in the volunteering.
I would put my name forward to be on the committee.
Okay. Anybody else?
Yeah.
I have a bit of health.
So.
Yes, I believe if I would be allowed to do that.
So then that would put it at full then. Okay, so then, does everybody agree with that then, the volunteering?
You managed to get right out of the little spot.
Please. Would it be appropriate to have a motion to address that? So it's actually included in the minutes. So I would, move that the board, accept the positions of Ms. Carlton, Mr. Eccles, as the members of the executive committee.
Anybody that's willing to second that? Chad?
Yeah.
Motion moved then. Eccles,
I'm in favor. You calling the vote on that motion?
yeah, okay. All in favor?
Thank you, Mr. Chair.
You can tell they're gonna be very helpful.
I can tell.
I can save these for next year.
Yeah. Is there any amendments? Done, you go to 6.0, the approval of the agenda. By Mr.
I'll
Eccles.
second.
Okay, second. Favor. Good. Disclosure of pecuniary interests. Something else to do for that. No,
Simple as. This is cool.
okay. Okay. 8.0, adoption of the minutes. For 8.1, Friday, November the 22nd, 2020.
Mr. Chair, for you, in the last meeting, there was a question from the board about the cold chain incidents, failure numbers, and how they compare to previous years. We obtained the data, and the 2024 was a higher number than previous years, mainly because the ministry had changed the reporting criteria. And the previous years, 2023, there was 12. 2022, there was 24 incidents. 2021, there was 26. So the new criteria has lower threshold to call a failure. And in the background, actually, not every one of these incidents was considered a failure. If there was a margin of error of 2 degrees or so, we can still consider the vaccines intact. But it would allow us, and this is a new change from the ministry that, in my opinion, is very effective, because it allows us to detect fridge failure or human failure ahead of time and attend to it. So when we recorded around 60, it wasn't actually 60. When you look back, it was almost half of it. And that is somehow consistent with previous years. It's worth noting there are many variables that come into this number. 2022, the school vaccination program stopped. So you would have different denominator to actually count from. There are new vaccines every year. Some vaccines are allowed to other groups like RSV for children and for elderly. So again, those numbers are difficult to compare, but in general, they are under 30 a year.
Just a quick comment, Mr. Chair. Thank you very much, Dr. R and the team for pulling that together. It's helpful to compare dates from year to year, and I appreciate that context.
Thank you. Any other comments? Friday, November the 29th, Executive Committee. Okay. So the recommendation that the minutes, be approved by the Board of Health as presented. We have a mover, Sue, seconder, Mr. Peabody. All those in favor? Everybody? It was like,
Just Helen Claire and Denise, the communications coordinator.
yeah, somebody else there.
It's Dr. Arma.
Oh, it's Chris, sorry, it's Chris, the owls.
Oh, great.
Oh, I better hide.
I apologize. I am actually, blind in a corner of my eye, so I'm trying to pick up on the field of vision, so I apologize. 9.0 correspondence and media releases.
We will, Mr. Chair, we have 4 items on the correspondence list. The first one is a letter from the Chair of the Board of Health for Peterborough addressed to the Minister of Health. And the gist of it is support to the recommendation from the Health Canada report. The report's named the time to act at time. And in general, it's a strong support to Canada preparedness for the next public health emergency. And the recommendation, Mr. Chair, is to receive, we have endorsement of the correspondence with the state cause. The second item on the agenda is, or on the correspondence list, is a letter from the Board of Chair for Peterborough. And it's addressed to the Minister of Health for Ontario, and it has a strong support for creating an immunization registry, and that's one of the recommendations from Ontario Immunization Advisory Committee. And in essence, it's a database where all people in Ontario who receive vaccine, there is a record of their vaccine, and that would allow more efficient way to track the vaccine record in case of an outbreak or tackling any public health issue related to vaccines. And the recommendation there is to endorse. The third item is a letter from the Chair of the Board for Public Health, Sudbury and District Health Unit to the Ontario Minister of Health. And it is a call upon the province to appoint a qualified Indigenous person who is grounded in the community to be on the Board of Health. And I don't have direct evidence of what I'm going to say next, but when we last attended the Alpha meeting, myself and Chair Sanders, the number of health units asked us how to, we established a connection with the First Nations and communities in our area to have this collaboration effort. So I can see that there should be a direct relationship between the call to the ministry and our efforts locally. In all cases, my recommendation is to endorse. And the final item on the correspondence is a letter from the Sudbury Health Unit to the Sudbury Mayor, notifying them of the previous correspondence, number 3. And my recommendation there is to receive. And it's worth noting, usually if there is something local to a health unit, we receive it for information, but I do believe the call for more aggressive way to engage and reconcile with the Indigenous community would suffice for us to endorse the correspondence.
So the recommendation that the correspondence be received for information and endorsed by the Board of Health. Do we have a mover? Second, yeah,
Question, please.
yes.
Thank you, through you, Chair. I agree with the recommendations, but I'm wondering if this is an appropriate time. Dr. Era, I looked at the reporting schedule and I did not see specifically an emergency preparedness report that's coming. There's risk management and there's emergency management. I'm not sure if a report on the actions taken by the Brave Bruce Public Health Unit are included in those reports, or do we need to query staff about, what steps does this board, what steps does this public health unit take in that emergency preparedness side of the business? I'm not expecting the answer today. I didn't know whether it was included in those other reports or whether it will be one separate from those, just an update. These are the steps we take to be prepared for the next event, whatever that looks like.
Certainly, through you, Mr. Chair, we definitely have it, and it's included in the report.
In those reports,
In the,
risk management or emergency management.
in the emergency management.
Okay, that's fine.
Yeah, emergency preparedness is part of emergency management. And that's worth noting just for the audience that are listening to us, that the health unit does a tremendous work to coordinate with the municipalities at their own table for emergency management. So it is covered from many sides.
Any other discussion or questions?
Just a comment. I read that Indigenous Engagement Governance Reconciliation Framework. And I actually pulled that and sent it to our CAO of the township, because there's aspects of that that I think go beyond just a health unit. I think we could all be using that in the municipalities, and it's really worth looking at.
So with that, the recommendation that the media releases be received by the Board of Health for information, we have a mover. Chris, seconder. Kevin, all those in favor? Thank you. 10.0, medical officer of health update. Oh, where's? Oh, sorry, 9.2, media releases.
Thank you, Mr. Chair, and through you, there are 6 media releases on this month's agenda. On November 20th, Public Health issued a media release to announce an upcoming Attacking Medication Misuse campaign, which aimed to raise awareness that the safest and best way to dispose of expired or unused medication is to return pharmaceuticals to any pharmacy for proper disposal. Held in partnership with the Owen Sound Attack, the 5-day campaign provided residents who brought unused or expired medications to a local pharmacy in Owen Sound with free tickets to an attack game. And then a subsequent media release was issued on December 6th, and it shared the results of the campaign, which saw more than 170 bottles of medication returned for safe disposal. Public Health issued media releases on November 26th and December 3rd, following opioid alerts in Grey Bruce. The alerts came in response to clusters of drug poisonings in the area. And then on November 21st, an awareness media release was issued as part of Radon Action Month. The release encouraged people to begin testing their homes in November for radon, an invisible, odorless, and tasteless radioactive gas that could build up in homes and impact health. And finally, Public Health issued a media release on November 29th to announce that we had received notification of the first local lab-confirmed case of influenza of the 2024-25 respiratory illness season. The release encouraged people to get this year's flu shot, which is a safe and effective way to protect against the flu. And that concludes the media release report.
Any comments or questions? The recommendation that the media releases be received by the Board of Health for information. Mover for that. Seconder. All those in favor? Everybody's in favor? This is starting to get on to work. I would ask if, ask the rest of the group here, if we should put something out in the media just about, people that are grieving at this time of year, that their neighbors go and check on them. If they know somebody that's grieving, so that they're not forgotten. Just as a nice gesture from the board. That's just a question that I would pose to the board to see if they're all in favor for that.
I will move on.
Yeah, okay,
I would second.
okay. All those in favor then? I'll leave that to the wordsmith there on the screen. Master. Thank you, Danny. 10.0, medical officer of health update.
Thank you, Mr. Chair. We have 3 items from the update. I will be sharing this in second. I included 3 pages from our report that comes every 2 weeks for the International Respiratory Virus Surveillance Summary. And in general, the influenza season is one of the major diseases or entities that we need to deal with in public health and the healthcare system, and it has sometimes disabling effect on hospitals and their ability to discharge to long-term care, and we do play a key role in it. And there is a way to forecast the type of season that we're going to see, and in general, I did highlight that part, but I'll highlight it again here. But the trends. It's not allowing to highlight it. More or less, influenza activity remains within low to medium to moderate level, medium level in the forecast at this time in the year, and probably it's easier to see in the graph. This is from the southern hemisphere, and forgive me getting technical, but the flu has three main types, two main types and other components, but A and B flu. And the trend of the transmission in the southern hemisphere in Australia and New Zealand in their winter, which is our summer, would be a good indicator to what's going to happen in the northern hemisphere. And you can see on this graph it's a busy graph, but the part that we need to look at is in the right, which is the percentage influenza percent positive. And it goes to the top of the season to around 29%. So if you compare it to the next graph, which is the northern hemisphere, and this past season, this last year, it went up to 33. So what we're expecting for this year is a bit less than last year, which is very good news for our healthcare system. And in general, it was a bit shorter as well in the southern hemisphere. And this is just one of the indicators that we'll look at, but it usually, with its simplicity, provides very robust and good predictor of what we will be seeing down the road. And I've shared this with the CEOs of the hospitals in third division. I'll stop there, open for a question if there's any question before we go to the next slide, Mr. Chair.
Questions or comments?
Thank you, Mr. Chair. The other item is it's an email I received yesterday from the Ministry of Health and from the Chief Ombudsman's office. It's confirming the changes in the regulations to public health on a few fronts. So I put it on the screen, and the regulations that will be changing are related to public pools, designation of diseases, communicable disease in general, and reports. Not major changes, but part of the feedback from the field to the ministry about the strengthening public health. And for the benefit of people who are new around the table, the Ministry of Health put forward an initiative to strengthen public health, and it has three components. One of them is voluntary mergers, and recently the total number of these mergers voluntarily are 4 in Ontario. And the second component is 1% increase for public health. It seems very small, but relative to the 0% for 10 years, it provided relevant good news. And the final one is a review of the public health standards, which is the regulations for the Health Protection Promotion Act. And those are some of these changes that are being implemented. The full review will be completed in 2025, and to the best estimate I know, will be released for action in 2026. And I do believe this came yesterday, December 19th. So we didn't include it in the agenda, but I thought that it's worth sharing verbally here. And again, I will stop if there's any question.
Any questions or comments? Through you, Chair. Do splash pads, are splash pads encompassed in the pool regulations, public pool regulations?
We do work with the municipalities on splash pads. I don't know specifically if they're included or I can get that information.
But I just didn't know there's more splash pads being constructed municipally than what pools are. And I just wondered if that was an area of concern that might be positively disseminated to the public sector. So whether there's, these are the things you have to watch out for. This is how you test it. Different from what it used to be. That was the only query. Thank you, Chair.
Through you, Mr. Chair, we definitely can bring a detailed outcome within regulations and see if there is more inclusion of those effect. In general, we work with municipalities and the public to ensure the safety of all recreational water. Obviously, not every beach in Grey Bruce, but we sample certain beaches and we definitely can bring a report on this.
Any questions or comments?
Just one minute. Mr. Chair, the one under the building code, camps in unorganized territory. What's the health unit got, or Ontario Health got to do in that area under the building code? Because if it's an unorganized township or unorganized territory, there is no requirement to get a building permit or anything under the code. Like, you're in an unorganized township, there's no place to get a building permit to enforce the code. And just curiosity, I guess more than anything, why that's.
Through you, Mr. Chair, as almost every issue that public health deals with, there are multiple layers of complexity. The underlying principle in dealing with access to the public is key. So if there is, for example, small drinking water system or private system is not for us to regulate. We can give advice on how people can protect themselves, but we cannot really enforce or regulate. If that changes, if there is access to the public. So the same system, if it is suddenly selling lemonade or coffee to the public, now it is anybody in the public can actually be buying that coffee. So obviously it's unorganized territory. So that's probably most likely, this came yesterday, so I will have to review.
Yeah.
But in general, when these things surface, it is the gray area where the public has access, and as soon as there is risk to the public, it would be the Board of Health's business.
Yeah, it's still just a strange one what's in there. You have three guys will follow at once.
The last item is the opiate situation in Grey Bruce, and similar to the previous updates, we continue to work with all partners, and that is our main strategic goal. And there is no change from previous updates from research.
So the recommendation that the medical officer of health will be received by the Board of Health for information. We have a mover. And we have a seconder at the same time.
Either one.
And either one. Question, comment, all those in favor? Everybody's in favor. Number 11, corporate services financial report.
Okay. For you, Mr. Chair, this is the October 31st, 2024 financial update. So as of October 31st, we had a cumulative surplus of $279,000. Of that, mandatory programs made up $132,000 of that surplus, and seniors dental had a surplus of $150,000. Year to date, our revenue exceeds our budgeted expectations as we had the increase in the Healthy Babies, Healthy Women program funding, and our interest income and miscellaneous revenues are above budget as well. Similar to prior months, our salaries and benefits are under budget by about $310,000, primarily due to gapping in vacancies in some positions. We still have active recruitment underway for various positions. In October, there was an increase in spending as our program managers started executing their budget utilization plans. We saw our surplus in materials and supplies, purchase services, and our IT supplies and equipment decrease as a result of this spending, and this trend continued into November and December. Surrounding 2024, we are still waiting on confirmation of funding for our RSV one-time funding request, our vaccine bridge request, COVID vaccine funding, as well as confirmation of funding for the Walkerton Dental Clinic renovation. We have not received direction yet from the ministry on when we might receive an announcement regarding these requests, but we're hoping since the third quarter report was submitted at the end of October, that it should, once they have all that information on Q3 on where health units are sitting in any surplus, that they then be able to create those funding letters for any approvals of one-time funding shortly thereafter. And that concludes the October financial update.
So the recommendation that the financial report for October 2024 be received by the Board of Health for information. Questions or discussions? Mover? Seconder?
I do have a question, Mr. Chair.
Yep.
I'm sorry, I get stuck on procedure. I just wait till it's moved and seconded before I ask questions. I'm sorry, that's just the process that I'm used to following. I'll be trying to speed things up.
Okay.
So through you, thank you for the report, Kim. And there is a surplus noted because of gapping and some vacancies. And I'm wondering if the board will be asked to address some of those staffing gaps and vacancies. We know through Dr. Ayres reports that other public health units have used different strategies to address that. And I'm wondering, will there be recommendations coming from staff regarding, this is an excess this year because of this reason, but if we fill to the full complement of staff, like what's gonna happen? Is that a consideration the board will face during budget discussions, or will there be another subsequent report coming to address that issue? I don't want to get too particular. We're in open session here. That's the comment. So.
Yeah, so through you, Mr. Chair, so kind of what's happening in 2024 is accumulation of various things. And so these are unknowns at the time of when we did the 2024 budget. So when we start to do the 2025 budget, we do factor in all this new information. We do start from the starting point of if everybody was here, full-time permanent, what would our bottom line be? And then from there, we kind of work away, well, this person might be off, or we're expecting this person to be a gap. And from there, we kind of plan, can we afford to fill this to balance our budget? So we are kind of factoring all this new information we have now about these various positions and what we know about them as we go into 2025 to kind of right size those budget lines. Did that answer what you were looking for?
Just to follow up, if there is a salary surplus at the end of the year, do we get to carry that forward into 2025, or does it go back into the pot and we have to start from zero again? That's a ministry direction, I expect. So
yeah, so through you, Mr. Chair. So anything unspent a year goes back to the ministry as part of the settlement that we do. We have to report any surplus, and it proportionately goes back to the counties and the ministry.
Thank you.
Through you, Mr. Chair, excellent question, and for the audience, the public to know what I'm gonna say it outright, the successful financial management from our financial team, but this. Most health units in 2023 had to have group layoffs up to 10, 20 individuals, depending on the health unit, that are even smaller than us. They had multiple layoffs or multiple individual layoffs, over 12, I believe, that are the same size as us. We had no group layoffs. And we did not ask for money from the counties. That's again, the surplus part of it is related to the associate officer fund position we're recruiting for, and it usually takes multiple years to recruit. We are in a very advanced stage actually to finalizing it, But for 2024, we didn't have an associate, and that would explain part of the return. And the second layer of credit for the finance department, again, under Kim's leadership, usually the regulations, like you rightly asked, does it go back to the pot where it came from? It does, unless you can utilize it. And in our last meeting or the one before, we put a down payment to the mortgage for the health unit. Not the norm for any organization to actually have enough successful management to save that and implement it. And that's going to be reflected in the coming years in a smaller amount instead of paying it as interest. But all in all, again, I do ask for credit for my team for many good reasons, but thank you. Thank you for allowing me to go, Mr. Chair.
Where we left off, yeah. All in favor, just didn't see, the calendar, yeah, there we go, calendar, put her hand up. Okay. Number 12, other business.
Mr. Chair, other business, there is the 2025 Board of Health Annual Planning Report, and I wonder if there is a candidate online. So we have a draft schedule for the year for the reports that will come, and there are a number of questions about. I can share my screen.
Yeah, I'm on.
Okay, I can do that.
Okay.
I'm just gonna zoom in the middle where people can
Sorry.
see part of the report. Am I controlling this?
No, it's me, and I can give it back to you.
Okay,
I'll give it
please
back.
go ahead.
No, mine doesn't work well, so yours is.
So the reports that come to the board are different types. Some of it is decision report, like the budget, the annual audit, and they have their own timelines related to what the ministry requirement is. The information reports about the programs and the operations of the health unit, and you can see that they have multiple reports every month. And some of them are bound by the nature of the business. For example, food safety and water safety. The best time to test beaches would be in the summer, so the report would be composed over at the end of the year and brought to the board. We can change the timing of it. Like there was a question minutes ago about the splash pads. That will be included in this report in April. We can definitely bring something earlier. Sometimes when we bring it might not be complete information for the whole year. And if there is any subject on the list that is desired to be earlier or to be changed, we can definitely comment on. This is a draft, and I know different mayors around Grey Goose have different interest in whether it's emergency or water or public, and if there's something aligns with your agenda, we can definitely change things. It's a draft at this point, and oops. And there are Board of Health planning cycle, which is related to the orientation. We're suggesting a session in January and a session in February. According to the policy, the earlier we do them, people will be more comfortable with the business of the board. And Teresa will be sending an email to see if the dates work for the groups. If you prefer to have this in February and March, since January's schedule most likely are booked, we can do that too. The whole schedule is a draft, and your input over the week would be helpful. It doesn't have to happen on the spot here before we finalize this. Any thoughts, any questions, Mr. Chair?
Any comments or questions?
Thank you, through you, the chair. I find it very beneficial if the orientation sessions were, as you've suggested, in the afternoon that were already scheduled to be here. Allows for some block the time in the calendars. Thank you.
I concur with that.
Yeah. The recommendation then is to accept annual planning and reports calendar and meeting schedules for 2025. Have a mover. Do you have any questions or discussions? Seeing none, all in favor? Okay. In camera? In the camera, we'll give you up for in camera. The adoption of in-camera minutes for Friday, August the 23rd, 2024.
So are we supposed to?
We haven't put a motion to move into camera, so.
Oh, sorry. So do we have a motion to move into in-camera?
Also move, Mr. Chair.
Okay. Question or discussion? Seeing none, all in favor? We'll move into in-camera, sorry. Back into open session, we wanted to say that we affirm. We've only discussed what was on the agenda for the closed session. And do we have a mover for that? Seconder?
You don't need a
No,
motion.
we don't.
Oh, no,
We
need a
don't have a
motion.
motion for that, just that we affirm that we only went in camera to discuss what was listed
Okay.
on the agenda.
It's a reporting out statement.
Okay. So, good then? I guess we do it. Adjourn.
I think we need to have a motion to direct staff to negotiate with non-union workers as recommended in closed session.
Okay, is that your question?
Yes, it is. Okay, or is that sufficient for what you need?
When say negotiate, to
Provide guidance there.
provide the increase that's discussed in camera.
Direction was given to staff in camera.
As direction given on the staff in camera. Go forward, for the
Not
2025 budget.
Okay, so Ken move that, is somebody seconding that thing? Kevin?
Words, you know what we mean.
Yeah.
Wordsmithing will be done down here.
Yeah.
I hear that clicking.
I don't even want to attempt to say that. Ellen Claire, your hands up?
Yes, Mr. Chair, I'm not sure if we are, I know we're in open, but if the video is working because I'm not seeing the room or anything, just wondered if it had been switched on again.
Oh, the camera's still on.
Because we'd want to capture those motions in public session, publicly.
Thank you. Any other comments or questions before we adjourn?
I have one more, Mr. Chair. Just a matter of,
It's just a point of order. There's a motion on the floor. Should be voted on before we go.
Apologies. You caught me? We did question or discussion already. All those in favor? Okay, carried. Sorry, Helen Claire, continue. I apologize.
not at all, just wondering, since you came in wearing a Santa hat, if we should be addressing you going forward as Saint Nick.
It's my Mickey Mouse Santa Claus hat, and I only wear it for special occasions. I'm going Christmas shopping 4 days earlier than what I normally do.
And me.
Need a motion to adjourn then? Motion to adjourn. Chris? Kevin? All those in favor? Meeting is adjourned. Merry Christmas to everybody that's listening out there, and a Happy New Year. Anybody that's traveling, safe travels. And, wish you all the best in this holiday season and look forward to seeing everyone in the new year.